say 7 necessary phrases. I'm a student, you are my examiners. So I'm a student, my answer is, first of all, I should greet my patient. The next, I should check patient's details, name, surname, age, gestational age. The third necessary phrase is, I should explain what examination I will perform. The fourth, should explain how I will perform this examination. The fifth, I need verbal consent. The sixth, I should wash my hands and put on my gloves. I repeat, it doesn't matter what practical skill you will demonstrate. You should say these 7 necessary phrases, sentences. And after the demonstration, the last necessary phrases later I'll say. Remember, first necessary 7 sentences. Why it's important? If you don't say these phrases, you lose around 15 points. Excellent or 5, 90 to 100. So if you lose 15, you will get only 4. So you need these phrases. And during the exam, you will see a short situational task. For instance, the task, perform the pelvic measurements on the phantom. So, and this is the correct position during the examination. 3 index fingers. And guys, you should see the numbers. If you take like this, it will be incorrect because you don't see the result. Look, please. First of all, you need your 3 index fingers. Guys, you are with me or not?
Teacher asked to join with you.
Wait a second. Then measure. Normally, you should say 25 to 26. This is the phantom. You should say the normal parameters. So, normally measures interspinous diameter. This is interspinous diameter. Normally measures 25 to 26 centimeters.
Okay.
The next, palpation, the most remote points of the iliac crest. Then measure. Yes. Plus 3 centimeters. So 25, 26 plus 3 centimeters, 28 to 29. Then the third basic size is intertrochanteric diameter. This is, yes, this is intertrochanteric diameter. But this is the phantom. You don't see legs. So you should say, next to the acetabulum, we can measure the right and the left greatest trochanters. So this is intertrochanteric diameter. You should say normally measures. Guys, remember 30, 31 centimeters. The next, I should place my patient on the left side. Put on yourself. Yes. Again, take the tonometer. And I will measure external conjugate. And you should say external conjugate. This is the distance between upper border. First, you should palpate. Okay. Do you feel? Okay. Do you feel the? Yes. Then measure. So I should find the upper border, the pubic symphysis, the last lumbar, the first sacral vertebra.
Okay.
Yes? Yes. So this is, guys, you should say, this is external conjugate. Normally measures 20, 21 centimeters. Okay. Then again put on, yes, and during by manual examination, looks like a gun. Yes. Yes. Diagonal conjugate. Look, this is your middle finger. And you will try to reach promontory by your not index, but middle finger. It's impossible because middle finger is longer than index finger. So this is the distance between lower margin of the pubic symphysis and promontory. The next, you are right-handed or left-handed? Right-handed. Use your index finger of the left hand and mark this point. I mean the lower, yes. Oh. So, this is the diagonal conjugate. Remember this point and take the pelvimeter by your left hand. Remember this point. Yes. Yes. From this point to middle finger, not index. This is the distance, this is the length of the diagonal conjugate. Normally measures, guys, 12.5 to, excellent, to 13 centimeters. Guys, you mustn't estimate this result. Why? Because this is phantom. This is not a real parameters of the real woman. So you should know the normal parameters. So normally measures 12.5 to 13 centimeters. So in conclusion, my teacher, normal parameters, normal basic sizes of female pelvis are interspinous 25 to 26, intercrestal 28 to 29, intertrochanteric 30-31, rotate. External conjugate 20-21, and my teacher put on diagonal conjugate. This distance 12.5 to 13 centimeters. These are normal basic sizes of female pelvis. And at the end of your correct answer, you should say, I should inform my patient about the results of the pelvimetry. The first sentence. The next sentence, I should thank my patient. I should take off my gloves and again wash my hands. So in conclusion, 11 necessary sentences, 7 plus 4. 7 before demonstration and 7 before demonstration and 4 after demonstration. If you want to get a very good mark. Is it difficult? No.